So with that, I would like to introduce Dr. James Munro. It is a pleasure to have James join us again as our first international speaker for this forum. He's a familiar face for most. James is the CEO of Care Opinion UK. He has had the role since 2014 with a rich background in clinical medicine, public health, health services research. James has dedicated over a decade to developing Care Opinion's online feedback platform, which is the cornerstone for patient and provider communication in the UK, Ireland and Australia, and soon other parts of the world. James's work emphasised the crucial role that patient feedback plays in informing and improving the culture and delivery of services within healthcare systems. His approach is driven by a commitment to make it safe and simple for people to share feedback about their care in ways that fosters real learning and change. This is supported by evidence that online feedback not only boosts staff morale, but also benefits organisational culture by promoting openness, learning and continuous improvement. Today, James will share the research on how patient feedback impacts frontline staff and the broader implications for healthcare practice and policy. His session underscores the profound belief that feedback serves as a relational, a dynamic that not only addresses immediate care concerns, but also shapes the future of healthcare services by fostering a culture of responsiveness and continuous improvement. With that, I welcome James. Thank you very much, James.
Great to be here, Tina. Thanks so much for having me along. And hello to everybody from Sheffield in the UK. It's an early start for us here. So I've not got very much time, so I'm going to rattle on at great speed, and I'll just see if I can share my screen to start off with. Hopefully everybody can see that okay. That's looking good. Yeah, great. Okay. The goal here is to say something about what we know about the impact of online feedback from staff. Quite often from a clinical perspective, clinicians will see this as in a sense, an optional extra. It's nice to hear from patients, but it's not essential to the quality and safety of care. So what do we know about the evidence on the impact on staff of sharing patient feedback? So what I want to do is cover things in this order. I'm going to say something first about why patients post feedback online, because actually that's quite important in understanding the kinds of impacts that feedback can have. And then I'll say something about the research evidence. There's not a vast amount of research evidence on this issue, but it's an emerging evidence base. And we can say something about that. And then we can talk about whether we can increase the beneficial impacts on staff of the feedback that people are posting online. So that's what we're going to talk about in the next 15 minutes. And we'll start off with the evidence on why people post. There is evidence from the Inquire UK project undertaken by Oxford University a few years ago, which produced a number of papers. And this was one of the first. This was a survey of UK adults to ask who'd shared feedback online about their care, not necessarily on Care Opinion, but across all kinds of social media, and why they did that. And this study found that, surprisingly, 42% of people had read feedback about healthcare online, and 8% had shared their own feedback. So this was back in 2018. Those figures, of course, may have changed by now. But this is the graph I want to draw your attention to. This is the why. Why do people post their feedback in this way? And you can see the top 3 reasons here are to inform other patients, to praise the service, and to improve standards of care. So very positive, pro-social motivations, excuse me, for posting feedback online. And the reason I share this is because it'll be interesting to see whether patients actually achieve their goals in sharing that feedback, praising the service, improving standards of care, and so on. From that same Inquire UK study, we also have another paper which has been very influential, and if you only get a chance to read one piece of research today, then I would make it this one. I think this is a really interesting and nuanced study by Fadila Mazandarani, who we've had on our Care Opinion research chats quite a few times now in the UK. And if you're interested in any of these papers, incidentally, if you go to the Care Opinion UK website, click the research link at the bottom of the page, you'll be able to navigate and find these research outputs. There's a lot of research listed on our research outputs page. So what Fadila and her colleagues did was they interviewed about 40 people who'd shared feedback online and asked them why they were doing that, and went into greater depth, obviously, than you can go into in a survey. And there was this strong emphasis on trying to help, trying to improve, trying to support healthcare to be the best it can be. You can see these examples. The NHS is under such huge demands and everything else, but unless we tell them what's wrong, they can't put things right. And then somebody else saying, I firmly believe that in a subtle and perhaps longer term way, I'm contributing to change. And this is what Fadila Mazandarani called caring for care, this notion that what people are doing when they're posting their feedback, whether it's positive or negative, is they're trying to look after the care and the care system and the people providing care to help make it better for other people. So it's a strongly kind of pro-social, altruistic set of motivations, if you like. So do they achieve that? Do patients achieve that? I mean, that's and part of that is the impact on staff. So that's what we're here to think about in this session. And last year, or actually over the last couple of years, we reviewed all the evidence available globally on the impact of positive patient feedback on staff. And the reason we focused in this review on positive patient feedback is for two reasons, really. One is that our experience on Care Opinion is that over 70% of the feedback we receive is positive, which surprises people because quite often clinical staff assume that most of the feedback is going to be negative. But it turns out that most of it is positive, 2/3. And the other reason is that there's a widespread culture in healthcare that assumes that positive feedback isn't really particularly valuable. It might make you feel better for 5 minutes, but it doesn't really make a difference to the quality and safety of care. And I think that's a mistake. To think that we can only learn from negative feedback, I think, is wrong. And I think positive feedback has a lot of benefits. And so we undertook this review. This review was led from Nottingham University in the UK. I played a small role, but not very much. You can see all the authors there. And we reviewed 68 studies published around the world. There are studies on this question, surprisingly, from all 5 continents globally. And there are a wide variety of studies. But to summarize it very quickly, this is quite a technical paper, and you might find it a bit dry if you do try and read it, but we can summarize it very quickly to say that there are a range of positive impacts from positive patient feedback on staff. And as you might expect, one impact is short-term emotional benefits, feeling motivated, improved psychological well-being. So that emotional lift that we often talk about, the effect on morale and so on. Perhaps surprisingly, there was a second category of benefits, which was impacted on work and home interactional benefits. So improved home life relationships, an improved sense of work-life balance, for example, were described in some papers. And then thirdly, work-related benefits like improved performance at work, improved staff retention, reduced absenteeism, reduced burnout. So these are all important things. And obviously, they're important to any healthcare service manager or policymaker to think, well, if we can get these benefits from positive patient feedback, that's got to be worth considering. So these are significant benefits that we should want to learn more about. So that's the big picture looking across 68 studies, but I just want to focus in on one more study now, which is a case report of introducing Care Opinion in one NHS trust in the UK. And this study was based on interviews with staff after a year after Care Opinion had been introduced in this particular organisation in the UK. And the organisation had been struggling and was under regulatory attention to improve. And that was one of the reasons why they introduced Care Opinion. And again, you can find this paper through our websites and open access papers. If you go to the research output page, if you're interested in this, you can look at what staff in this organization were saying about their experience of care opinion. I just want to highlight a few quotes from the paper. And Tina's already mentioned some of these issues. An improvement in morale. So you can see here somebody working in an emergency department. She says, I really love it. Working in the emergency department, you see a lot of terrible things happen. You see a lot of sick patients. So for me, it's such a refreshing change because we get predominantly positive feedback. It's just so nice to be able to cling on to that. I think it helps improve morale. It helps people's resilience as well, to know there are actually some really grateful people out there. And of course, this quote is entirely consistent with the research evidence that we just looked at from the previous paper. And then confidence. Somebody said, care opinion has impacted the confidence I have when I'm on the ward, because I feel like I can talk to and comfort patients and relatives more since responding to challenging comments. I thought this was an interesting example of taking skills learned online into the offline face-to-face world. And then lastly, pride. It gives you a sense of pride. You know, you can recognize actually the work you're doing within your department is working. So these really nice benefits for staff, again, important and worth having in any workforce. So let's just turn lastly to this question of, can we increase these kinds of benefits? So people will often say, well, you know, positive feedback, what are we supposed to do with it? Where does it, you know, how do we use it? How do we get these benefits? And can we increase the benefits that we get through the positive feedback that flows through care opinion? So I just want to, we don't have strong research evidence on this, but we do have an awful lot of practical experience. So I just wanted to share some of the things people are doing in the UK with their feedback, positive and negative. And this is one of the most popular things to do. People share it. So sharing the feedback is absolutely crucial. If you want to produce an effect on your workforce, on staff providing care, you're not going to do that unless you share the feedback with them. If they don't see the feedback, if they're not seeing it regularly or daily or even in real time, then how can it possibly have an effect for them? How can you produce those benefits? And so one of the most popular things for staff teams using care opinion to do is to share it, make it very visible. And this is one of the ways people do it. You can see people creating their notice boards, putting up their stories, sharing them not just with staff, but with patients too, coming to the service, and getting all kinds of positive vibes and good feelings from that, and encouragement, and all the other things that we've just talked about that affect on morale and confidence, on pride in the service. So that's the most obvious thing you can do, and that's a very simple and straightforward matter, isn't it? And again, you can see in these tweets people describing the impacts of sharing stories in this way and seeing stories that are being shared in this way at work. So there's Louise at the top. She says, one of the things that gives me joy at work during my week is reading so many positive stories on care opinion and seeing how other stories help to make improvements. So that's a really nice explanation of what's going on here. And then Sarah on the right here says, I purposely stopped by our Edinburgh Emergency Medicine Compliments Board and read our latest care opinion SCOT feedback today. A timely reminder that doing what you can despite the challenges really, really matters to folk. Again, you can see in this tweet that really strong sense that reading this feedback on a regular basis, seeing the impact that you're having for people, can be profoundly motivating for teams, especially at times when they're are feeling really weary and really tired from the workload. So people don't just create their notice boards and stick stories up. They do it, of course, electronically as well. These are some examples. The top one there from Northern Ireland, display screens in a facility showing stories in waiting areas, and then the bottom one in a GP practice in East London. And that bottom one is using the care opinion slideshow feature, which anybody can use. And that's a quick and easy way to share care opinion stories on a display screen, so anybody can use that today. And then I thought this rather creative one on the right was rather nice to share as well, celebrating the responses that people post by giving them a mug there saying, I got great feedback on care opinion, and celebrating that positive feedback with staff. I thought that was a pretty nice way to do it. And then perhaps slightly more ambitiously, but might be something you want to think about, sharing feedback openly. This is a photo from a corridor in a mental health facility in the UK, in which they've taken a quote from a story shared on Care Opinion and painted it on the wall, so that everybody who walks past that quote can see the impact and the importance of that service on service users and how people are benefiting from the kind of compassionate care they provide. And again, that kind of thing can be extremely motivating for staff. So this is my last slide. I'll just finish up with this. You can see the impact here pretty much in real time on Twitter. Somebody saying, when I read this, I remember why I became a nurse. Thank you for appreciating us and what we do. And you can see here the connection, the way that stories connect people back to the motivations, the values, the ambitions that they had when they entered healthcare in the first place. It's easy to forget those things, to become disconnected from our values, our intrinsic motivations. And I think stories can help us reconnect with the things that took us into healthcare in the first place. So these are some of the things we know about impact. I'll stop sharing now, and of course, always happy to take questions or comments.
Thanks very much, James. Do we have time for questions?
Yeah, we could just take a couple of minutes. We'd certainly feel free to post your questions in the chat. Our team is on standby and also can flag these with James. So thank you so much, James. That was really poignant and it's very creative ways to be really sharing the feedback. Really appreciate those. Also, just a note for our attendees that I have allowed you to share your mic or unmute and share your camera as well during this question and answer time.
So one thing I might add while we're waiting to see if there are any questions is, so this issue of the impact of gratitude coming through Care Opinion, because there is this extraordinary gratitude stream and it can be very powerful, and we don't know a lot about the impacts of gratitude. There is some research on gratitude. But one of the things, again, we're working on with the University of Nottingham, who led on the research review, is we're looking at whether we can create a program of research just much more explicitly around what impacts can we achieve if we directed the gratitude in a very deliberate way towards frontline teams. Can we create new forms of intervention through Care Opinion that would allow us to create new and beneficial impact for staff through the gratitude that people are sharing? So that's really where we're wanting to head with this, is learning much more about this.
Doesn't look like we've got any questions, but they don't have to stop now. If there are questions that come to your mind afterwards, please post them. Thanks very much again, James, for kicking off the forum with your excellent presentation and for introducing us to some great research, which some of the links have been shared. Please take the time to visit the papers and to gain further insights from those. And I think a really key thing that you highlighted, that a large proportion of the patient feedback is positive. So and how this brings benefits to staff, such as the ones you've pointed out from the papers, emotional benefits, whether they're work-home interactional benefits, work-related benefits. We just need to know how to use the positive feedback and how to increase the benefits. So, and you shared excellent practical examples of how this could be done, or at least trialed. And we will have questions, time for questions perhaps at the end as well, if anyone comes up with those.